So we're here at the American Society of Hypertension meeting with Dr. Alan Terlinksy. Dr. Terlinksy, tell us a little bit about yourself and your practice.
Hi, I'm Dr. Alan Terlinksy from Washington, D.C. I'm an ASH clinical specialist in hypertension. I practice and promote wellness and cardiovascular protection and prevention and preventative medicine. Today we're at the third day of the American Society of Hypertension 25th annual meeting. I've been coming here for 10 years. Hypertension still remains one of the major health issues, promoting long-term health and longevity in patients. Today we learned that we're getting closer to our goals, but we must do better. And one of the ways we can get to do better is by making sure patients have good blood pressures. The big problem we've had over the years is we're never sure if a patient's blood pressure is good. We've learned about some better technologies that are available. One of the technologies that I've been using for several years, which I find very useful, is 24-hour ambulatory blood pressure monitoring. Sometimes when the patients come in to my office, their blood pressures are up. They claim it's through their parking hassles or their day at the work or day at the office. And we know we just can't let patients go visit after visit assuming that there's some other issue with their blood pressure. So there's nothing more reassuring than having a great device that measures their blood pressure over 24 hours, and we either know whether the blood pressure is controlled or not. I've actually used it for many different reasons. I've learned and I've been surprised by some readings when some patients claim that their blood pressures actually feel low. I found that, and we've been able to reduce medications. But for the most part, it's very reassuring for a particular health function such as control of blood pressure to know that a patient's blood pressure is well controlled.
So what are some of the indications that you're doing ABP for, and how are reimbursements looking like at this point?
Well, I think ABP should be almost like a pap smear or a mammogram. Blood pressure is so important. I've developed what we call a private medicine or a concierge medical practice that tries to focus on cutting-edge preventative medicine. As part of what I do is each patient gets a 24-hour ambulatory blood pressure reading as a routine, just to make sure that they don't have hypertension. It's still the case that hypertension is a silent disease, and unless someone is measuring their blood pressure frequently, we never know whether the blood pressure is up in a given individual. There are no symptoms.
Are you finding people who have nocturnal hypertension and non-dippers? What's your patient population like?
My patient population spans from very young and seemingly healthy people to typical middle-aged patients, elder patients, geriatric patients, and many of them have surprising findings. Some of our patients, the elderly patients, we find that they don't drop their blood pressure, which is physiologically normal. That predisposes them more to congestive heart failure, strokes, arrhythmias. And when we see that, we have to take a closer look at their blood pressure control, as well as lifestyle and other factors that may affect the blood pressure. We've been picking up a lot of nocturnal arrhythmias associated with hypertension. Many patients with sleep apnea, even patients with relatively normal weight, suddenly their blood pressures zoom up at night, and in several cases we found that this was based on sleep apnea. Many patients seem to have dizzy spells during the day. They're on modest medications, and we find that their blood pressures are much lower than we think, and that's another reason why we use the ambulatory blood pressure monitor.
And are you billing for these? Are you charging the patients, or is it part of the concierge service?
Well, we try to submit to insurance. Right now, Medicare pays for one specific indication for doing an ambulatory blood pressure monitor. But I try to, and many of the commercials will pay, it's reasonable. The thing I try to emphasize with patients is that it's an investment in your health. And so for a modest amount of money, sometimes maybe $100, a patient can be assured that their blood pressures are well controlled. I mean, how much is it worth to be told that you're not likely to have a stroke, go into kidney failure, develop congestive heart failure? Is $100 a very large amount of money? For most people, no. I have in my concierge preventive medicine practice built this in to the overall membership fee.
That's awesome. That's great. And any other closing thoughts on ASH, and any insights or future directions here?
Well, first of all, I'm so happy to be here in New York, and I'm so happy to be here amongst so many dedicated physicians. I get renewed every spring. I look forward to this, and I think that we're getting closer and closer to being able to provide patients and patients with a long-term blueprint for their health. Hypertension is still king.
That's awesome. Thank you so much.
Bye.
Wonderful.